Would you mind reviewing the timeline so that, because I've sort of missed, this is the first time that I've been able to listen. So
With regard to the course?
Well, and what's due when? Have I missed
sure,
that was due?
No problem. So actually, I will probably would be wise I post that for us. If I didn't in the first session, I will make sure it is posted. So we are the course is 16 weeks course. We will start with, we had a week one, which was the adult education. So that's the one that I think you didn't have a chance to actually hear, but you rather had an opportunity to see what's going on there. So, and then this week is research and literature. Next week is going to be IPAC. And now, as of next week, we're kind of getting into more of what IPAC truly is and getting into the nitty-gritty pieces of every day what IPAC does in terms of surveillance, healthcare-associated infections. Week 4 is going to be microbiology, and I'm going to be very upfront with you. This is going to be one of probably our heaviest lectures, and that's scheduled to be Friday and Saturday. So that will be June 11th is the Friday, and then the following Saturday is what the second part of that class. So it would be June 11 and 12. And then for week 6, we have a PowerPoint presentation you will be creating, and then in week 8 is a quiz. And so I'm not sure, as I said, I'm not in front of my own computer. I apologize for I'm kind of telling you out of my memory how this timeline looks. So, and then there is a break at week 8, and that's when we will have the quiz, and then we will continue with week 8 to 16, and at the end you will have an essay to write. So in the meantime, 20%.
I think Leonardo sent us all that in an email.
Yes, it should be. You should have had that. Yeah. What is that?
Yeah, in unit number 1.
Yes. Yeah, we did share that. Yeah. So, so it was just a question to go over it again. So I have a question for you. What do you guys see? Do you see now the screen with literature and research? Or do you still see me?
Yes, it's up
We
now.
see both.
Both
Okay.
you and the presentation.
Okay, can I make the presentation bigger, Leonard? Is that the little square thingy? Okay, is that better now?
Oh, I'm looking at the same thing. Like I see both of you. It's not bigger.
Okay. Leonard, how can I make the presentation bigger? Is this better?
Sorry, I forgot to put myself off mute. Now, just above that presentation that you guys see, there's a little white 4 arrows pointing to each corner. So if you click on that, what it'll do is it'll make that presentation the full size, if you will, of your...
Leonard, I can see full Cornelia when I click on that. I don't actually see... Oh, wait, hold on. Maybe the one next to the presentation you're saying. Hold on. Oh,
Yeah.
I got it. Okay.
Yeah. So if you click
There's a
on
lot
that,
of me to see.
and even if you
Yeah,
put
I'm
your mouse
getting very
over
close and
it, it says
personal with
make
you.
screen share full screen. And but yeah, Camellia also it's in bigger size too because you're playing you're playing the presentation rather than yeah.
So I will just start in interest of time. I know everyone has waited for me, and I apologize once again for this. So this week we will go through the research and literature part, and the idea behind it is that you do need it in your day-to-day work. So you will need to complete thank you, Crystal. So you will need to do a lot of research before you start teaching. So last week we were talking about the education and involvement of all our colleagues and how do we engage people, but this is kind of more of a background piece for us that we need to do before we take the center stage and start actually educating people. And I think Burnett actually said in discussion that at times we feel like we're just going out there and there's really no support for IPAC practitioners, in a sense that there is no education for us. So in the IPAC world, we are the ones who are responsible to grow our own knowledge. And that you will learn how to find where are the good resources. I'm sure many of you already know you have your go-to websites and so on. But when it comes to writing your papers, if you're going to go to any sort of conferences or you're writing papers to submit to be published, and in many instances, when you are actually presenting any of your projects to your senior leadership, you will have to support your statements with the science. So how do we get there? This is what we're going to go through in this class. So I'm going to take you on a little bit of a journey. So just bear with me. Okay. So what do we need? We need, of course, available search tools. And in this world of electronics, that's your internet access, that is your laptop or your desktop computer. Many have phones that can help us with the different research, but I always like to do my research sitting in an office. Also, what you need to do is know how to use these tools. And in the world that we live, there's so much information now that is accessible to us. So more of our work will be identifying what is that good, solid information that we can rely on and use that information to build our own research or build our work or build our project on. Okay? All right. So I'm sure many of us have been pulling our hair these days, like this guy. I know I have been doing this just minutes before the course started. So, but research shouldn't be any pain-causing experiment for us, and we will get there that you will feel very, very confident to find the right places for right information. As I said, it is large volumes of information. It is a lot of information that's available. It's convenient, so that's good use of our online research. It's easy to find. The problem with the online research is that you will not always find all information on one spot, so you have to branch out and look into different places and finding out how to formulate your questions to get where you need. It can be quite frustrating when you start looking. Often you're not getting the right hits back. It's usually because we did not ask the right question. Okay? All right. So when you start looking into your research, so there is old school, and I know I had a conversation with one of you with regards to the books. So print, it's still available, I find, and we learned that APIC book is no longer available for purchase in print, simply because they want to maintain fresh information, provide real information in real time, but also its cost that comes with the print. The issues with print is also that it will age. So we'll get about that as well. But with your web access, the issue that also comes with challenges. So as you know, anyone and anybody can post on webinars, on websites, create their own blogs, and so on and so forth. So now pretty much everyone has a big microphone and can speak to whatever their little heart desires. And when we are on the search for information, we have to be very, very careful. What are we actually taking in? Are these valid resources? Are they supported by facts, or is this somebody's opinion? they don't necessarily always line up, or they may actually be fully lined up with what we are looking at, but we still have to be careful what are we picking. So you always have to look at who are the authors. Are they affiliated with anyone in particular? So sometimes you will find that authors do line up with big pharma or whoever that they line up, and they're supporting each other or supporting what that particular cause stands for. So do your research also on your authors. You will quickly learn in the field who are the authors that you can always follow through, and you know that they are the gurus in the field, and you recognize their names. I can think of Dr. Zoutman, I can think of Dr. Alison McGeer. Those are the names that are in circulation, and you will see them on the papers. They will not always be on all the papers we are looking at, but those are the names that I know when I look and say, okay, I know this person is behind the paper, so that's a good valid source for me. And then also looking for other known names is another thing. So with any paper, with any information, you have to be careful because people can be biased, or the information may be misleading. I think now it's really good time to reflect to what we see with regards to immunization and COVID vaccines. There's so much information out there that is not coming from proper channels that people are just discussing. That's their personal beliefs, and it's all clashing and coming into the front and center of our attention. So when we are writing papers, yes, you can read that, of course, for your own purposes, but that's not something we are referencing in the papers. And with some of these publications, what also it's important for you guys to know is that many papers, many of the research and a lot of like gray papers or white papers, gray literature is not actually easily searchable. So you have to know exactly what you're looking for. Even when you go on a government website, you have to actually look into their search engine and dig deeper, because not everything is tagged to appear. Okay, have you all with me? All right, so the print. So there is print that has been in print for many years. Some of them you, I'm sure, have seen lingering around your offices. Often they collect dust in our offices, but they're also a good source. The issue with print, as I said, it is sometimes it does age. Not all, again, you will not always prescribe and subscribe for all of your prints, so sometimes you will miss some of the publications. The good thing about them is that they're always, when you go back, you know that there is a peer review, that the work has been done, that the authors have been reviewed, and so when you see the paper is published, you know that there is significant work that is gone behind these big names that are printing in publications. Again, the bias also does exist, so if somebody who is publishing the paper, so just think about, like, say, coffee or wine. How many times in a day, so as you're going through the week, you hear, oh, the study was published, wine is good for you. The next day, oh, the study was published, the wine is bad for you. So it's also looking at who is actually sponsoring the research and who is behind that research that's being published, and what is the scope of the research that they're doing to publish all these conflicting studies. So once you start looking into reading the papers, you will find whether something is actually applicable to what you're searching for. All right, I still have you all with me here. Okay. Okay, good. Yes, we will definitely. I hope that you will actually come out of this course using a lot of the material, and the hope is not just to get you through the course, but also to get you certified in CIC. But bottom line, and the most important part, is that I certainly hope that you will use this in your day-to-day work and that you find it beneficial. If you think that you would like me to cover something in addition to what we are going through, please let me know. I can always share some information with you. Okay, so let's move along. So when you get into your web search, so typically what people do is, what do you do when you go on the internet to look for something? Where do you go? Does anyone have a place where they like to go to search for things? Or are you just going through your apps and landing on certain pages immediately? How does that work in the world? Google. Google. Yes, there's nothing wrong with Google. It's an amazing search engine. It's really, really great. It's actually, I was looking at some of the materials that when I was studying for my first certification, and what other engines were recommended, and I can tell you some of them have died along the process. I think Google ate them all. But yeah, so Google is the first stop that we all go to. I apologize for this. Okay. And then, so when you go into Google, what it comes, Microsoft Edge, okay, Madeline is a great tool for sure. Ask Dr. Google. Yes, absolutely, Leonard. So when you go into Google, you have to be very, I guess, aware is what I want to say about the limitation. It's not the Google's limitation, it's the limitations of the paper that's being published. We'll get later on into how people actually do tag within their own documents so that these papers do pop up. But it's something that they're referred to as invisible web. So you have actually to go in and say, if you enter CPE studies, I can tell you my name is not going to come up on any of those first pages. But if you actually start looking into particular name of the studies, you will see that this will start coming up. So, but if you go into Google Scholar, you will start looking into these CPE research papers that are published, and you can use that. What I would say, we were discussing the bias and accuracy and limitations of the internet and web. There is, as I said before, everyone now has a Facebook account. They have Twitter, they have TikTok is another thing that people have. Everyone has their little stage and they're performing on the stage. It's not necessarily something I would say to completely exclude, because you will find also reputable agencies and universities also present on social media. And that has become a more prevalent in recent years, just because it was so overwhelmingly populated by people with no credentials and sharing information. Everybody knows how when you go on Facebook, there is all this information about vaccines. And as of lately, when there is a questionable post, they are now posting a link to reputable resources, which I don't know how much of help that is, but I think it does indicate that there is something questionable in that statement, or something is suspicious in that statement. Mm-hmm. Yeah, so we will get into the words a little bit as we go through. That's interesting, Jagdeep, that you have actually a search engine specifically for COVID. Okay, so so when you start looking into your invisible versus visible web, you have to choose a topic you're looking for. So I think when you start writing a paper, you should have an idea what you're writing a paper about. Usually we start writing papers based on our experiences, whether we had an outbreak in certain related to a particular organism, or you want to write about education in adult education, or you want to write about SWOT analysis and how SWOT analysis is used in IPAC. So once you kind of get that framework of what would you like to write about, then you can start expanding and digging deeper and adding layers. So Google is the topic of choice. We discussed this. We've seen everyone is using Dr. Google to find information, but there is also other libraries, research tools, and mega searches that you can use for more scientific papers. So if you actually enter, say, into Google CPE, but and it's going to come and list thousands and thousands of papers. But if you actually start linking, like, say, CPE plus zinc plus contamination, it narrows it down to much more focused topic to what you're looking for. Okay, so what search tools we are using? There are search engines. We discussed that. It's your Googles, Yahoos, and Bing, which apparently, if you, the most searched item in Bing is actually term Google. So that just tells us how good is DuckDuckGo. Yeah, that's a good one too. And then your web directories and meta search engines. So those are the tools that we are using to look for information. When you start searching and looking for your results, you always have to start with, again, as I said, with the topic. So how are you going to, what you're going to enter is the words that you want to find in relation to your end goal. So if you want to say, for example, VRE, but then also you had, for example, in your own outbreak, maybe a linkage to environmental contaminants. So that would be another word or verb or verbiage to use to enter into the search engine. So it may pull up different environmental contaminants that may not only be linked to VRE, which you also can draw and find similarities between the topics that are already published, and you're looking for similarities that have occurred in these events before. So when you start looking into this, also, how do you find what is a good paper, what is not? You're looking at number of, you will always find in the citations, or how many times has it been cited, how many people have read these papers. So there's a lot of these statistics that can help you to validate and make a decision whether this paper is actually something you are looking for. So when you start conducting your search, always consider the type of words that apply. So this is what I was saying. You think about the words that are carrying the weight of your research. So say you had this, let's stick with the VRE outbreak, and now you want to maybe find research that was related to a similar unit. So maybe VRE outbreaks in ICU, or VRE outbreaks in NICU or surgical department. So once you start adding all of this, it will kind of get you a more focused and narrow down to your problems. Sometimes you can narrow too much and get nothing out of it. So then you just start kind of playing with your search and identifying what is applicable. That's actually the biggest chunk of your work, is going to be that research and collating information to use to reference. So what kind of information are you looking for is what you want to publish, what do you want to write about, and always approach your problems from multiple angles. So think about it, is this something that is maybe published in the States? It could be something that's done in Europe, so that's something to think about also, whether you're comparing apples to apples and oranges to oranges, or are you actually comparing two different healthcare systems? What is driving for the publishing, again, of this information? So you have to know how does that healthcare system function in the other countries, or also, so for example, I remember looking for surgical site infections and use of PPE. So we had a situation where our surgeons were, it was kind of coming and going into the OR, into the theater. The doors are constantly open. We were investigating the possibility of surgical site infections being linked to a lot of traffic. And somebody said, well, in Japan, they're really not using any mask when they're doing the performing the surgery. So we started looking into it. And what it actually turned out is that, in fact, in Japan, there is a less of use of masks in the theaters. That said, the discipline is a very different scenario than what we have here in Canada. And in Canadian hospitals, your operating theaters are no different than any other workplace. People are coming in and saying hi to each other. They come in, visit, close the door, and there is no discussion. There is no talk happening in Japanese hospitals during the surgeries, where we carry on here as just like any other workspace. There is discussions about baseball and how was your weekend and how are the kids doing in school. So all of that is very, very different. So if you're looking to compare, you have to know a little bit about that background. Where is that information coming from? And is it something that is applicable to the environment that you're trying to apply it to? Okay. Yeah, you're right, Marina. Usually we do get the cited information, and you can also get the number of how many times has that particular document been used and cited in the other papers. So you can tell if someone has cited that paper, and the highest number of citation usually is an indicator of a good quality paper. Not to say that is always like that. It could be for completely opposite reasons cited, but it's a good indicator that is a good paper. So when we get into defining our search, they're called Boolean operators. So I just kind of try to make you hear a little graphs or diagrams. Where is that area that you're looking for? So we are using these ands and ors and nots when you want to either narrow down or expand your search. So if you're looking at COVID-19 and then you enter and Kingston and nail salon, so this little area in here, right, the darkest between COVID and Kingston and nail salon is what is going to get you the most narrow search. So you want to find the nail salon that is being linked to COVID outbreak in Kingston, Ontario. So that's another thing. There's many other Kingstons around the world, so you may want to add Ontario in there to find what particular event you're looking for to read upon or use in your own paper as a reference document. If you're looking into these ORs, you will only end up with a broader search. So it's either going to give you either COVID or personal service setting or Kingston all separated. So we'll end up with a lot of papers there. And then when you want to exclude something, so say because coronavirus has been quite long time present in felines, so we know that. So you want to exclude any papers that are discussing cats, tigers, what have you. So you then will say corona, not feline, and it will list out, again, tons of paper, but at least it will exclude your cat out of your research. All right. So using the search terms. So when we start using our search terms, you're looking for the keywords. Again, what is that you're looking for? So it's corona, coronavirus, and COVID. So when you enter your, so just for exercise. If you want, you can go enter into Google Corona and look how many articles are listed. When you enter coronavirus, because Corona will list the crown, will list the beer, coronavirus will list coronavirus related articles. And because these search engines are actually very, very elegant, they will most likely assume what you're looking for and list what is actually mostly searched articles, but you have to be careful with that when you're looking for something that may not be the hottest topic of discussion around the world, and it is within the framework that you're looking for. So if you want to learn about specifics, you can change your Corona search to COVID-19 prevention, and that will now give you a whole different, much narrower list of articles that you're looking for. So as I said, you can use these ands and ors and nots to play around and try using these words in Google search if you want, you can do it now or when we are done. So we'll see how these search engines actually work. It's quite an elegant event that is happening in front of our eyes when we are looking for. So when you start choosing your general terms, so this is for your practice, you can use the same search engine for the entire activity, and then you start with your original term or try looking for your synonyms or use these ands, ors, and nots. And let's see what you discover. So I've done the research myself, and then when I entered the word flu symptoms, I came out with 289 million results and came back within 0.94 seconds. But when you enter your quotation marks, because what happens, it will enter everything that contains word flu and flu symptom together. But when you enter under quotation marks, it narrows down that search for sure. And then it will only look for articles, papers that contain exclusively the words flu symptoms together. Again, it's not going to be the great search. It's not going to be what you necessarily want to cite in your papers. It's going to come up with all sorts of articles, of all sorts of discussions that are in public domain. So it's still a lot to sift through. So when you get to the point that you have all this information at your fingertips, you now have to start thinking, how do you sift through this information? What is that is not really that you want? Some of those will come with a completely wrong topic. It's not applicable to any of the items that you're looking for, or maybe somewhat similar, but it's really not enough information. Maybe they just touch on a topic in a sentence or two, could be completely wrong. With the new research could be old. Usually you want the newest research and newer published documents to reference. That said, even with that, there's still a possibility for errors, even with the new publications, or there could be a typo, or could be an error in research, could be also that there was a mistake in typing, and so you just have to be careful with what are you finding and how are you using your information. Some of this information will be very, very shallow and will not go in depth, and it will not analyze and provide the depth and layers of information that you're looking for. So sometimes it could be a completely untrustworthy source. It could be, I don't know, my aunt posting about COVID. She doesn't believe in COVID vaccine. She doesn't believe that COVID exists. She has a blog. Usually she talks about cookies and baking, but she really feels strongly about COVID and she's posting there. So you may get something like that as well. My aunt doesn't do that. I just completely made that up. but also could be something that is giving a little bit of a wrong tone when you are reading the paper. So it could be something that is it could be well-written paper, but it's, say, opinionated, and again, it's more weighted by bias and something that is a personal belief of a person. So, and you get into this next step, which is the evaluation of your search results. So as I mentioned before, you have to have very clear idea where you want to go. I will tell you also that many a times when I start looking for something and researching, and if I don't have a clear idea where I want to end, the research shapes the direction of my paper too, because sometimes it's just not enough research available to me that I can actually use as a valid resource to hinge off my own conclusion and draw my own conclusions from what I would like to bring to the end of the paper. So you want to have a general overview. You want to see different views in the papers. So you want that ability to see how are the same problems seen from the two different sides. But you, as I said, you have to be very careful when you start looking into that, finding whether there is a bias and what is driving and who is driving these researchers. Sometimes it could be that there is a big coffee company behind some of these studies and saying, coffee is great, you should have at least 10 cups a day. And so when something like that comes, you should wonder, why is coffee so grand and why should we all have 10 cups a day? I'm not saying to people who do that they shouldn't. I'm just using these examples. And then you always make sure that you allow yourself enough time to permit enough time to do the proper research, but so you're able to do that in-depth exploration. So you want to be very, very confident in the materials that you found, that they are solid materials, that the topics are right, that they're supported by statistical review. So sometimes you will find when you open these papers, there's absolutely no graphs, no numbers, no tables. It could be depending on a topic, but generally speaking, if you're looking into any sort of outbreak or any sort of changes in numbers of infections, you always want to see their bell curves. You want to see the rates, you want to see the attack rates, you want to see the ratios in these papers, because that means that they actually have got involved into statistical analysis, and you too should present these numbers in your own paper. Again, if it's in relation to any source of, say, like reduction of CPE cases in the hospital or reduction of MRSA infections post-surgical. So you always want to see that whatever measure that they put in place actually had some outcome. May not work, but at least they have conducted that statistical analysis and they're looking at whether there was any impact from the measures that they put in place. Okay, so now we get into, am I in the right? Okay, so when you get further into evaluating your research and you're looking into your search results, when you end up with no specific rules to find out about the information you're looking for, so you need to be a little bit more focused on the purpose of your material. Who was responsible for publishing? So back to the credibility of the authors, and also how frequently is the information updated. So it could be something that's been around for a while and so a web page that's not been updated at all for weeks and weeks, so or months, sometimes years. So you want to make sure that they're keeping their web pages updated. So it's usually when you're looking at, could be a government page or a university page, or could be somebody's blog. So that can be frequently updated, but then you're looking into, again, the credibility of the author. So also when you find information, don't always rely only on one resource. So go back and look if there is any other reputable resources that are sharing and corroborating that information. So you want to make sure that, say, if one web page speaks about the risks that are related to smoking and how are these risks linking back to the health, one person may be posting on their webpage that there is nothing going on, that's all a hoax, and then you're looking at that, who is the author, then you start looking at, okay, so is this something that's published by government, is this something that's published by a major hospital, is this something that's published by university, and then you start looking at, okay, so if all of these big names with good reputation, with good credentials behind them are talking about the same or similar outcomes, then you are looking into that corroboration of information, and always look at your degree of bias. So when you're looking at the credibility, always think about, how does this sound to me when I'm reading? Is this something that's a little bit colored in a certain fashion? Do you hear a little bit of a tone that usually you get really quick to recognize some of that language that may not be technical. Also, when you're reading the government pages, I find they're written in a very simple term, but they're always very accurate. They always write their pages, the web pages, or the government web pages are always written on the level grade 7. So it is easy for general public to read. When you start looking into your published studies and published research papers, you will get into a much more technical terminology. It's not as easy to read. Not to say that one or the other has more credibility, it's just the way the papers are written. So you will also learn that as you go. So Renette is asking, where do I get my information? I always go to the government website. So I live in Ontario, and I always start with my local public health agencies. So I start with, depending on what I'm looking for. So the first stop is always my local health unit. If I'm looking for something like, say, outbreak information and outbreak management in the hospital setting. So if I'm looking for any documents that are issued by that particular public health unit, that's the first stop. And then I start looking to the provincial level. Usually I will go to Public Health Ontario. Public Health Ontario has amazing amount of resources, and you in forum have noticed that I've been sharing some of that information with you. And then I'm going to Public Health Agency of Canada, Ministry of Health, and long-term care facilities. And then I usually stick within my own province. And So the way the search expands for me is if I cannot find information on these levels, I'm moving out. And once you start looking into information that is not anymore in your country, you have to be careful where you're drawing that information from. Again, sticking to your reputable sources, CDC, World Health Organization, and that's how I personally look for information. It could be, I'm sure different people do differently, but that's how I do my search. They sure do, Marina. Yeah, they absolutely do. Public Health Ontario actually has been replicated. Their information has been replicated around the world. And Public Health Ontario comes with a lot of credibility, and a lot of other agencies around the world respect the scientists that work there, and materials are, as I said, many, many times replicated. So then back to identifying and evaluating your credibility of the authors and the pages where you're landing there. So it's whether they're making assumptions or just stating kind of more of a generalized information. Not supported with any facts, not supported with references. So usually when you land on these well-written pages, web pages that are owned by government and universities, there's always a ton of reference at the bottom, and they're always accurate and linked, and you can open these papers that they're referencing, so you can use even that to read further on the topic that you are looking for. Whether this web page, for example, that you landed on, is it commercial or is it non-commercial? Who is behind it again? Are they actually advocating for anything in particular? Are they have their own agenda that they're using this platform to push for their own agenda? And also look for the copyright notices. Always look for the links and sources cited. I think Marina mentioned that. So you can always find information if you go on any of these web pages that I mentioned to you. If you're going into, say, Toronto Public Health and you're looking for their fact sheet on rabies, for example, when you open that fact sheet, you will always find references where they're drawing their information from. If you find any information that is on any web page that does not have a reference, that's something to be concerned about. So we are continuing with our evaluation of the search results. So I think Vernette asked, how do I know what are the pages that I'm going to? So one good rule of thumb, it's not always so accurate, but always look at your ending of the website, so .com, .net, or .org. So anyone can have that. Anyone can register under that name. In Canada, it's a little bit different because all our websites end with .ca. But also, if you're looking into more credible resources, usually you're looking into .edu, which is educational resources. So it would be your universities in the States end up with .edu, or .gov is another one that is the governmental website. So, but again, with the Canadian government, you find that we have a little bit of a different endings with our websites, but you will learn that there is these government logos on that you know that you can trust. I mean, everyone can put the logo on, but it's something you just get familiarized with the pages that you go to. I find that some of our ministry pages, sometimes they take you to the dead page, and some of these links are not updated just because of the sheer volume of information they have, and sometimes they're not the best linked to the other pages, and you just end up on a dead page. So yeah, Jagdeep, your local health units are usually going to be addressing topics that are relevant to this particular health unit. So you will be seeing discussions and topics in relation to their population they are serving. They're never going to get into anything broad and deep in terms of the research for IPAC, for example. You will find there your line lists, you will find there the fact sheets that you may use and you want to use. You will also find like things like signage that you can download and print for your facility. They cater a little bit different, and they tend to be a little bit more in depth and deeper, but I would say they don't go as broad as these larger agencies that are overseeing larger population in areas, so like provincial websites and provincial government or federal government, where they're covering all aspects, and they're also differently directed by the legislation. What are they supposed to cover? So when you're looking into your health unit web pages, you will find things like the boiled water advisory and such town due to E. coli. Public Health Ontario will not be posting information like that. You will find information about what boiled water advisories are, how to submit water for testing to the public health labs and items like that, but they're not going to be discussing that communal aspect of an outbreak in a community. I hope
Yes, I agree with you on that for sure. Like, I've been in long-term care homes, and like Public Health Ontario, for example, with COVID, wants 1 antigen testing and 1 PCR every 7 days. But there are some local public health units that are saying, hey, we want 3. You need to be tested Monday, Wednesday, Friday. So like they give extra. It's never less than what Public Health Ontario wants. But it's like, if you're going to look at Public Health Ontario, yes, you should. But at the same time, it depends on where you're working, that you also need to be affiliated with your public health unit and what, like, the local public health unit and what they want, because sometimes they want more.
You're right. They very often will want more because, again, they're more prescriptive and they're the ones who are enforcing the law. So your local health units are operating under the Health Protection and Promotion Act, and they're the ones who will be closing the facilities. They're the ones who will be issuing tickets. They're the ones who are following the legislative piece and have the power of issuing the closure orders and so on and so forth. And that's the reason why they're more prescriptive than the other agencies, the larger agencies. And with the larger agencies, they tend to be a little bit more, I wouldn't say less prescriptive. It's just that they're more inclusive and considering the broader population, and that's the reason why they are not as strict. So to your point, you always want to follow what your local health unit says, because they're also independent. They're fully independent, and we are talking about Ontario. That's not across all the rest of our provinces in Canada. But in Ontario, there's 36 different health units that have the power, and they're completely independent. They can write their own bylaws, of course, under the Health Protection Promotion Act, but their own prescription is their own prescription. Okay. So I think we covered this part, okay? Okay. So when we start looking into the visual and appearance of some of these websites, for example, when some of them are so, I find like the government websites are not always the cutest looking. They have a very prescribed look, every page looks almost the same. There is always that easy navigation pieces versus websites that you end up and they have a lot of photos and there is videos playing in the background. And so you will find that if something does look nice, it does not necessarily mean that is always the best information. So it's not an indicator of the credibility. It's not indicator of the good sources for us. It's nice to look at them. We all like to look at pretty pictures. All at the same time, bad design is not an indicator of a bad information. So some of the websites that I've landed in my research, I wondered what has happened here and how these things are working. But again, it's not necessarily a proof of wrong or unreliable information. So when you start looking into your components of research studies, you always have to look at your title and then the abstract. So I find like when I'm doing a research, I look, of course, at the title, and then you quickly look at the abstract. You don't have time to read. Some of these studies are 15, 20 pages long. You don't have time to read all of them. So you're kind of quickly look at your abstract, see what they're discussing briefly in there. And then also you can look at what kind of methodology was used. Is it something that is in line with what you're looking for and what you're hoping to find? Or it could be completely opposite of what you're looking for, and it's easy to discard right away. Also look at your problem statements, literature review, and also, so you can always go back to the last page and look at their references as well. And one of my professors was always teaching us how to do really quick search. She would always say, look at the title, read the abstract, and read the conclusion, and then you can go back to find out for that meat in the paper. But when you're saving your papers, you can just find your title, read your abstract, and save it for later to go into a deeper search. So of course you want to be also able to look at their how did they conduct this research? What kind of studies are these? Are they prospective, retrospective? You can also look at the sample size. Of course, you want to be able to review the papers that had ability to review the larger sample sizes, because the smaller sample size can be skewed. Or look at your data quality. So you can always review other papers and then compare which one is actually more fitting and that you find more reliable. Also look at what questions did they address. Also look at how is this information presented in terms of the tables, the statistical analysis, what did they use in terms of how did they measure their associations, and then also I'm just reading your chat here. I'm sorry, I started giggling at the chat in the corner. And also look at the sample size of your population. So you want to look at, is this something that is, again, comparable to what you are doing? And then always look at the end at the discussion and look how did they interpret their findings. So I know I had situations where we would put measures in place and there was actually not a positive outcome. It actually had a negative outcome. And you still can write about that as not necessarily what you were hoping to achieve with the measures put in place. But I think it's also a good review for other people to take a look at and say, oh, this didn't work and this is why it didn't work. So you can still write about, I would not necessarily call them failures, but the studies and research that may not ended up in anticipated with anticipated goals. So back to how do you read your papers, always look at these references, because that's where you can also look at what did they use to research for themselves to validate the quality of that paper. Okay. I'm so sorry. I'm getting used to my husband's computer. It's getting quite, I'm all over the place. So when you're looking into your problem statements, you always look at what is the lead in and what direction did they go, and how original is this paper? Is this something that is being significant and valuable? So how do you justify the problem statement, whether it's how would I describe this to you? So when you're looking into into the paper and you're looking into their problem statement, you always want to look at how did they explain that problem statement. We'll get into it a little bit more. So when you look at that problem in context and you're looking at what is done in the past, always look into your the variables that come in. So you can look into the stuff that you were reading, but also look into this paper and look at what other studies did they use and how do you find what's relevant and what's not relevant. And then also looking into your literature review that does, how do they describe information and how is this being further analyzed and critiqued. So they have to take a step back and provide an assessment of a problem and put that in paper to say, so we have, say, introduced the cleaning with accelerated hydrogen peroxide, and now that has actually caused more damage to the surfaces. So that wouldn't be something that you wanted to be your end result, but they're including this into their paper and actually taking that time to turn around and say, we did want to kill the VRE, but it actually ended up, say, melting our lines on packs or something like that. And then also look at how deep is this material. I cannot stress enough that you want to have meat on these in the research papers, and you actually can say, you never want to use one, of course, but when you're looking into that research paper, it's a solid written research paper that is giving you enough so you can grow your own from there. Okay, so I think Marina mentioned what is cited. So this is, again, looking into what are the people who are publishing using as their resource. So this is another way to identify also the credibility, also the reliability of the paper, or you can also go on these government web pages. They will always have research paper that they have done. So you can go back there and go back to the original source and you can use that as well. But you can always just say, okay, I'm satisfied with what I see on the front page. There's enough cited work behind, so I'm okay with using this as my resource and using that as a reference. So it's pretty much your decision and what is your comfort level. I find the more comfortable I am with certain topics and the more I know, I get more critical about the papers that are written. If I'm researching a completely new topic to me or something that I'm not familiar with, it takes me more time to identify and find the right papers. So you'll find if you get established in certain topics and that becomes kind of your area of expertise, you will quickly find all the good research for yourself to create new papers. So why are people using some of these papers to as a reference, and why are they citing? So usually you want to look back at people who had put work before you got there. So you're looking at, so for example, for me, I know people that work in the same area and they're writing about the same papers, and I will always reference their work because first I know that they're writing really good, well-researched papers. I know they're well-respected in the field, but also it's always a good idea to link back to people who were leading the research. Now, you also want to always give credit to people who have kind of paved the way for you. And it gives you credibility as well, and your paper looks more research as well when you're doing that, and it reflects the work that you put in researching. But it's important also to recognize that other people whose work we are using have spent hours and hours working on certain papers. So you also want to be able to identify the methodology. So if you say you are using a paper that uses similar methodology, similar to your research or similar to your outbreak or similar to measures that you are putting in to change some outcomes, so you want to cite those because they may not be, I think I mentioned before, if you're looking into cleaning agents and cleaning surfaces, and say CPE or VRE, so they may not be the same organism, but they're from a similar family, and there is certain similarities with cleaning the surfaces around it. So you can refer to parts of the papers that are not necessarily exactly the same topic. So you also want to look at if there was any corrections of the work, so you're looking into that, citations as well. So sometimes people will go back, and if they found some revealing information after the publishing, you always want to check that. Sometimes it does happen that there is also that correction in a work, so then they will also maybe add additional references as well, but also they may be using these references to criticize someone's work. I don't find that a lot. It happens, but it's usually not what's done in the scientific world. People are not writing these papers to necessarily criticize each other, but sometimes they will criticize their own work because their work has evolved and they have found different or additional findings as time has evolved, or we have different types of equipment, and they will reflect to their own work and change some of that work and use that as to how did they improve their own processes. Or as I said, this is something that usually people don't dispute each other. As I said, I don't find this so much in the scientific papers, but it does happen. Okay, so when you're looking into your other observations, when you're looking into your papers, always look at the authors that do fail to cite the work that they're using. So if there is a paper and there's no proper citation, so that's something to be aware of when you are referencing that paper. So we as humans, all of us included, we tend to gravitate towards the work that is kind of in line with what we are looking for. So if you're looking to support your ideas, that's the work you want to cite. That said, it's very fine line where you kind of almost end up in a bias that is resulting in paper that maybe become almost colored in only one-sided. So you want, when you're looking into the paper, whether you're researching a paper or you're writing, you want to be objective. You don't want to present only one side of that particular topic. So it does happen, I find, with us as humans, and especially with when you're a new author and you're just entering that stage of writing papers, we tend to be a little bit one-sided and we don't necessarily see the full picture. Again, it's not necessarily because somebody wants to hide something, it's just simply because of the level of experience. So you also, when you're looking into these, the references, you're looking to recognize the work from the previous authors that have published. So you always want to reference the work in terms of almost saying, expressing your gratitude and using your own paper to, it's kind of like almost a nod to their work, I would say. When you're looking into the citations, there's different ways, and you will find that if you're moving from one mode of whether it's web or it's paper, you will see that there is slight differences in the way that looks. There's different styles of citations for all of you that have been through university. Some may have been a little while out of university. Some of you might have just come recently, and you know that there is different types of citations. There are recognized citations, recommended citations. So there's few that we all kind of gravitate to, and then there is also how certain, so if you go, for example, for Public Health Ontario, they have their own recommended citation, how they like to be cited for their work. So when you're looking into your references, you can always look into the different ways, as I said, of these references. So if you're looking into your scholarly papers, you're always looking into that recognition piece of the work, but you're also looking into possibility of missing. So how would I describe this? When you're referencing a paper, be careful to so if it's like, for example, if it's electronic, when you're copying links, make sure that link is fully grabbed, because if you enter you're missing a letter or a number, that link is no longer going to work. So those are some of the oversights or mistakes that do happen when we are working. So always double check that your links and your references that you're referencing are accurate. So when it comes to your inaccurate referencing, it's usually an honest mistake. I don't see that would happen, that people would actually do want to, in their own publishing, submit wrong information. I'm sure that does happen too, but usually it's either misunderstanding of the paper that you're reading and how are you interpreting certain information. It also could be misquoting, or you could be entering a wrong page. So it does also happen with the pages, with the research and publishings that do appear in different publications. So sometimes you will see, oh, this sentence was on page 7, but when you actually go into, if you open from any other publishing site, it's the same material that's written by the same author, just the way they format their pages could be on page 6, for example. So just be careful that you are referencing and giving them the right landing page as well where they're going. Sometimes if you're referencing, say, a website, I mentioned this before, the links can also be dead, or the page could have just moved. So some of these, those are some of things that do happen with referencing. Usually also sometimes you will see that if you're paraphrasing something, you can change accidentally the statement. So being just very careful in how are you writing and how are you referencing back these papers. Also look at your the impacts that you have, it's, as I said, it does have not only impact on your paper and how your paper is written and the quality of your paper, but also your paper may be further cited as well. So it becomes, your paper will become, once published, becomes a part of this collective information, and people will go back and use it and cite it, so it becomes a part of a global knowledge kind of thing. And it is critical that in the world where we are professionals, and whether we are publishing or if you are going in to present anything to your senior leadership, that you are maintaining that credibility with well-researched, thoroughly researched work, and that's properly cited. So, okay, when doing research, is it the best to check one or two authors or multiple and give me a reference from those? So, yes. So, ideally, you want to look for more than one author. Ideally, you want to look at more than one paper. So usually when you're looking into your research studies and published studies, and they're usually written by more than one author, usually. So you will already have there a bunch of authors that you can probably look by their name, which I think Marina has showed us that that's what she's done. So she found that author that I shared your paper last week, and then she just used the same name to find similar papers. So that's one of the ways to look at it. And of course, you always want to go and look deeper and find maybe more work of that author and see how deep and how wide did they expand their work on that particular topic. Or you can also look for other completely different authors on a same or similar topic. So the more authors, the more paper you have to support your statement is always giving you more of that wealth in your own research. And anytime you use any of these papers, even if you're not citing them and if you're kind of extrapolating information, always make a point that this is the paper that you used. So say if you're looking into a C. diff studies, and you may not necessarily write about it, but you're extracting some of that information and giving you an idea, you can always reference that as well. If you're presenting to, say, to your senior leadership, you can print some of these studies also, or print the papers that you used and bring them for them to read, so they can take that also after the meeting and they can refer to it. Or you can follow up with an email and say, these are the papers that I used to investigate and support my statement or support my idea or what you do. So yes, Marina was very curious about our previous week topic, so she was quite active and sharing papers. I actually have to read one more that she sent. So, okay, so let's move along. So when some of the deficiencies when you're doing the review is excluding some of the landmark studies, and you may exclude them because you may not agree necessarily with what the findings were, but it's critical that you stick and read about them. So I will say, like, for example, when we say one of the studies that was talking about autism and vaccines, although completely debunked and they retracted the statement, it is one of the studies that we do and should mention when we are talking about the misinformation, for example, or misleading information. And people are afraid to mention some of these more confusing or misleading or conflicting papers in fear that may strike a different conversation and take it away. So you have to be well skilled around also coming around to why are you using this particular paper to leverage your own statement. Sometimes you will use outdated materials, and I will say there is time and place to do so. If you're looking at referencing some of the historical findings and you want the particular study to be referenced, so that's okay. But if you're looking into whatever is current, what's happening right now, always look into the most recent published studies. You don't want to look into anything. Ideally, you're looking into 5 to 10 years of studies, but with the time that things are being published nowadays and how fast things are moving, you can actually narrow down that that time period. That said, you may also find yourself in a situation that there is actually no work done, in sufficient work or work that is fitting your work and your purpose, so you have to extend that to the older studies. There's risks that do come with that, so be aware that you don't want to use outdated materials. So looking into also information that may not be relevant to you or not being relevant to the problem you're trying to address. So I'm trying to understand what you're asking. So how do you reference something that was referenced on a publication? You have access to that publication, but the original, okay. So I would say if the original paper is no longer available to you, I would look for another publication. I'm not sure what are you exactly dealing with, but if you're reading any of the papers or any of the publications on the government website, try finding something that is more recently published. But that would be my advice to you. And also look at by the name, or I'm not sure what exactly happened with your publication, and I'm having a hard time really imagining the particular event that has happened here. But I would say if something that you have either printed and it's like maybe a brochure that you really like, and then you're looking into where is the original coming from. So if it's referencing a document that is being retired, I would stay away from that, referencing that publication for myself. There's always something else and fresher that came out. Sorry. Okay. So also when you're looking into you're welcome. Did I answer your question? Okay, good. So when we're looking into some other deficiencies, you can find that some of them are just poorly organized, or as I said, your material is not relevant. And I think most of your problems are always going to come around your relevancy and the depth of material that you're looking at. So sometimes they're just not enough, or they're not relevant to what you're looking. So you will end up spending a lot of time finding sometimes what you need to. And some of these papers also, what else can you use that may not necessarily be just the research? You can also use some of the gray papers. So I think that we discussed here, those would be your brochures, or some of the white papers that government agencies publish. So they're not necessarily your research papers, but they're usually a collated information and gathered information, so you can use that. But again, be very careful, it's coming from reputable resources. And then some of these sorry for that. Some of these are just going to be written in such fashion that are intended for a certain population. So it's very, very specific, addressing a very specific target population. So when you're looking into your research, it's important that you're looking into the studies, but also look at what is also kind of on the outskirts of your research. So what I'm trying to say, those ones that may not necessarily fit in your answering your question, but look at also what are the almost like synonyms to the topic that you want to write about, and what are they writing, and whether you are in complete conflict with them or are you getting too close to them. So you're always looking into this, that your research has to be, it has to be somehow a logical extent of what you were doing, and your paper has to be in line with how did your research go, or whatever. If you're looking into your, say for example, an outbreak, and you want to write about an outbreak that has taken a place, you also want to look at, when you're collecting the information, collecting the papers, you want to find that it makes sense what you're putting, and it's relevant to the events that have taken place in your facility. And now you're padding that with, supporting that with the research documents. So if you're talking about, say, VRE outbreak, and there was you found a transmission through shared equipment, so you want to support your paper with other papers and other research that talk about implications of shared equipment in other outbreaks, for example. I hope I made sense there to you, because I'm trying to translate this in a more applicable and more relevant and related situations. So when we are trying to find again our articles, so this is when you're going into your Google Scholar and that type of search engines, you will be looking again for the terminology, looking into the heading. So if you remember, I mentioned the title, look at the articles, and then you can always look into, again, adding your ands on ors to narrow down that search. Always follow the same citation. You see that a lot of these things are repeating wherever you end, whether it's a website or if you're looking into more scholar articles, it's very similar approach to what are you looking for. And I mentioned to you, always look for your authors that you have used their work before, so you know they're credible, so you can look at them, look who is citing them, and also look who are they citing in their work. So that's kind of becomes almost like a network that you can work within. So what we are looking for is, again, as I said, looking into your problem statements, literature reviews, methodology and procedures, and look at the terminology. So I find that if you're looking into your publications, for example, your publications tend like brochures and even the websites and web pages that are facing general public, you will find that they are speaking in more layperson terms, and that's perfectly fine depending on what is that you're using that information for. But if you're getting into your own scholar articles, you want to use, again, more of that technical scientific terminology. So instead of saying a bug, which is okay to say in your brochure, that is to be distributed to, say, for example, your family members and your patients or residents. So you can say something that is referring to microorganism as a bug, but when you're writing your scholar article or you're reading these, you will never find a word, a bug, describing, say, Escherichia coli or Campylobacter. So they're using their scientific terms. So this is another thing to look at as well. And are you guys good? You need a break? I think I put them all to sleep. Okay, so
No, we're awake. We're awake. We need a break.
I offer a break and then I get alert. Okay, so how is 5-minute break?
Great.
All right, let's do that. Leonard, do I need to go back for 2 slides, or is it okay?
No,
Okay.
that's okay. I'm doing their screen record anyway, so they're not going to miss anything. So.
Thank you. Sorry, today has been a lot.
That's why I always do a redundant recording. From the portal itself, and then I use the screen recording. And just to let you guys know, will take me a while to convert it to MP4. For some reason, it only will save it as a AVI or something stupid like that. And so I'll have to compress it and convert it over so you guys will be able to view it later with just about any, and I sent you guys all an email once again because like I said, I'm getting hounded with calls and emails. So just be patient for tonight. I made a modification on the back end. Might be easier for you guys to log in the future now. The development team, they just got back to me and said this might help. So I made those modifications, they said, and hopefully that will, help things along. But I'm recording this session myself using a screen recorder. And but just to let you guys a little warning, there might be a little bit of background noise. You might hear my little ankle biter going across the floor or whatever, but it should be to a minimum.
Those are the best sounds, really, having animals and children in the background.
Thanks.
All right, thank you so much, Leonard, and I apologize. Yes. Right. So so we were talking about the population that's been defined. So when you are providing that information in your paper, you want to say, to describe the setting that you're in. So what kind of hospital or long-term care setting, or how many beds, or if it's done study on your colleagues, how many staff, how many of the employed staff have participated. You may want to break it down also by age or gender, or the areas that they're working, depending on what are you writing. That stratification becomes more determined based on what you're writing about. So if you're writing about the patient population, you want to say their age and their gender, and also the setting that they are in. So if they're in ICU, or medicine floor, or cardiac unit, or in a long-term care facility, dementia unit, or anything that does actually potentially affect the outcome and also the behaviors of these individuals. So looking at also what kind of sampling did you use, and was that sampling size, whether it's appropriate, was it a random sampling, what kind of studies, when you're looking into this, was it truly randomized, or was there not necessarily always following those rules? And then if you're in a situation that you're writing about you always want to provide that information in the background and explain why did you make certain decisions in your study, so it gives you more credibility as well. And so it also for your reader, it's very clear that you do understand the impact and the consequences of certain populations and how does that affect the outcomes of your research. Also, when you're looking into any of these research studies, you're always looking into the methodology. So I think we've touched that. So, but when you're looking in, when you're reading your papers, they always have a special heading after they go to the abstract and objectives, then they go into the methodology of study. So you want to know what were the steps and what were the actions, how did someone actually conduct this study? So was it over a course of months or years, how many different facilities might have participated, what were the methods of sampling, what were the methods of processing these samples. So you will learn more about that detail behind the findings. So how did they get to where they are now? And so sometimes you will see also that that methodology may not be necessarily what you are performing. So at this point you may identify that you're not necessarily comparing exactly the same situations if you are using some of these research studies for your own referencing. It doesn't necessarily mean that they're automatically excluded. It's just something that you need to know whether that is what you're looking at or not. So also, how is the information collected? So what are the tools that they're using? So is it paper tools? Is it any sort of electronic tools? Is it something that people and participants are entering themselves? Was it observed by independent observers? Was there a lab involved? Was it internal or external or third-party lab? So all these pieces of information carry some value to you. So again, it doesn't mean that is discredited one way or the other. It's just something that you take in consideration and you're weighing it towards your end goal, and it's kind of adding and subtracting what you're looking to achieve. Also, when you're looking into your qualitative research, how are they doing that in terms of the numbers that are being pumped out of their own research? So was there another comparison done? Was how many times did they run the same samples to verify the accuracy of their own tests? And also looking at usually you start with these hypotheses. So it's you are looking into the beginning of the study and you set your hypotheses and you either want to prove it or not prove it. So you're looking at, were these assumptions that when you started something, did you actually end up with the results that you were hoping for? So then again, we are looking into this reliability. And so when you're looking into the methods and procedures, also looking into these consistent results. So usually we are talking here about the laboratory findings or the clinical findings that you would be looking at. And also who did their lab work. Was this a credible laboratory? Was what kind of test? So if you're looking, for example, a good example to use right now, I think everyone is familiar, is the PCR testing versus the rapid testing in COVID test. So you know that your rapid test will have a good returns on positive results. However, with a negative result, it may produce a false negative. So it's still a valid information for you to include, but you do have to include also that margin of error that does happen with these rapid tests, and that you are aware. And what were the actions that you may have followed after you identified that your either patient or staff was identified as negative and they were false negative. So speaking about being fully aware of some of the faults of the topics, of the tools that we are using, and how do you address those shortcomings of certain items that are simply available to us, or we don't have access to PCR testing to test everyone on the basis that is required to us. So I hope that makes kind of sense to you. And also when you're looking into your qualitative research is also looking at, again, that bias. So it could be intentional, but very often bias is not intentional. So you're looking also because you set your hypothesis and you want to reach that that end goal. That's the entire idea of your research. So we often are biased looking when we are doing our own research to find information that suits that end goal of ours. So being aware for you as a researcher that this is your natural flow, that this is what you're looking for. So always be aware that this is something that you want to expand and do a wider research on your own, and actually allow yourself for that margin of error and be comfortable recognizing that you might have set your hypothesis in a certain way and it may not be what you were hoping for, but you're fully aware of that and you can speak to that. Now also looking into your training and qualifications of the researcher. Of course, you want, when you are reading papers and citing papers and going back to papers, to use qualified researchers and writers who have a wealth of papers behind themselves. That said, very often you will find that some of these big names, they're usually professors, and the studies are actually completed entirely by their student body who are working on their PhDs, and usually that is their work, and they're signing up their professors on the papers, and they may not actually truly be involved in great depth as the actual researcher. Again, it doesn't mean anything. It doesn't have to say that is not a valid or well-researched paper or well-written paper. It's just something for you to know. And how do you know who wrote and who is the actual carrier of the paper? Is usually it would be your first name of the author, and then the further you go away from that name, it just tells you how these co-authors have been less involved. So that's a good sign to also recognize how these papers are written. And again, looking into your time and context and range of activities that have been observed. So the studies that are done over a longer period versus studies that are done over a shorter period, also looking at what kind of activities were observed and how much of these activities are relevant to the study. So again, you don't want to end up reviewing activities that have no impact on your paper. Then we are looking into our data analysis, and also how is this data collected? That's one piece, but now how are we analyzing all the information that's being gathered? So what are we doing with the information that's being collected from the actual work? So if you're looking, say, for example, if you're looking into that hand hygiene study that I just invented few slides ago. So if you're looking into the hand hygiene study and the alcohol-based hand sanitizer, so how long was this alcohol-based hand rub being used? So ideally you want extended period of time. Generally, I find these studies are done in IPAC world over summer when we are not so busy with flu season and with actual respiratory events that do tend to take our entire fall and winter. So usually that's when a lot of that work happens. When you are doing your alcohol-based hand rub sanitizer studies, it's critical to also observe your weather component, because during the winter months, skin ends up being drier, and this is usually missed through these summertime studies, that we simply don't have the same exposures to the weather, because in winter the skin is dry, and then people are doing a lot of missing their gloves when they're outside, so you have a lot of skin damage. And in summer that doesn't happen, so you may not have the same results that you actually, once you implement and start using a certain product, you may find that at a later time, when you install the sanitizers and you decided to go with product B, and that product may not necessarily be lining up with your population. So also, did you actually have that extended time or not, is one of the critical pieces of information. And also looking at who was tested. Did you also test your population that you know that are frequently complaining about the product, that they do have skin issues? Are they also a part of your study? So did you include them, and are you analyzing that information as well? And when you are analyzing that, are you actually saying clearly in your paper, okay, so we do know that about 10% of our staff does have skin condition, had a negative reaction, or that percentage may be higher, and this was the reason why we are looking into changing the product, and we have included them as well. You might have provided this product to them to go home and use it at home as well, to see how is this actually reacting outside of the healthcare facility? Are they having any problems when they're at home and mixing with their home product, and so on and so forth? So are you actually looking into a more in-depth, and are you providing that in your paper, is I think what is critical to make sure when you're analyzing information, to be able to speak to any nuances around your findings. So also when you're looking into your sample data, are you including that? And how do you verify that information that you gathered? How do you stand behind your numbers and your findings, saying, okay, so yes, we completed the study and we reran the test, or we have sent our lab results to independent laboratory, or we have verified our findings by the public health laboratory. So that kind of gives you more of that credibility, and that you, first of all, you're aware that there is a potential that something may not necessarily be the gold standard in your own facility, that you are aware of it, and that you have done your due diligence and actually send it somewhere else for testing, and now you can confirm that whether it is or it's not exactly what you wanted, but you've done that work to prove that whether it's working or it's not working, whether that information is lining up or not, but you're speaking to that, and you can adjust, or maybe you can use a calculation to adjust your numbers and speak to whether there is a different piece of equipment, or simply this is not something we want to use in future. Maybe this piece of equipment didn't really work for us. We are going to use product B or product C. Okay, so then what you do with your findings and conclusions. So you still have to question that paper. So whether you're writing the paper or you're reading, this is the questions that you would be asking either yourself as you're writing or yourself as you're reading. So how are these findings organized, and how are they presented? So earlier I mentioned you want to be able to produce graphs and charts and tables. You can also include pictures. That's all part and parcel of your research that you want to share. It's good to include any sorts of visuals, especially with your statistical presentations of your information. You want to show them your bell curves, you want to show them your null hypothesis, you want to show them if it's any sort of outbreak situation, your attack ratio. You want to show the numbers that speak to your findings, and that all are aligned and they're working together, and it's almost kind of like a weave of information that's coming out in tables and words, and also supported with your findings. So we are looking here about also, again, speaking about, is there any bias? You want to make sure. You're right. So I find Sharon is saying that she finds the physicians tend to like the bell curves and graphics. So you'll find that some people will find that type of presentation intimidating. And sometimes if you are showing just the numbers, it can be really hard to interpret. So to speak in a way that is, I think what is important here to say is to know your audience, right? So yes, you're right. So they're used to read, the physicians are used to read research papers. They're very comfortable in that world, in very scientific world where you are talking or with technical language, you're pumping out the numbers at them, showing them the evidence, showing them how any event has a causality and what was the end result, and they will respond really well to that. But you have to be really careful if you're going to present the same information to a different population. Those bell curves may not always work to your benefit in a different crowd. So you have also to be able to digest that information and be able to present it in a more approachable way, in something that is easy to interpret across the masses. Exactly. So I think it's important to not to come across as you are missing the point, because if people don't understand what you're talking about, it becomes really challenging for them to follow what you're trying to say. So to the point, yes, to physicians, absolutely, they like the graphs, they like the bell curves, show them all the numbers and statistics and any sort of calculations. They're comfortable with that. If you are going to present this material to your senior leadership, you still can use this, but you have to be very comfortable in interpreting this in layman terms, because often in the around the table where your senior leadership will be sitting when you're presenting or proposing either a change in practice or looking to purchase different products, you will have people who are not as technically skilled in that part of scientific world as you are, and they may miss the point. So you want to be able to speak to it that everyone around the table can understand you. So back to our paper. Yes. I did like your interstate analogy, though. Back to our paper here. What we want to make sure is also that in the end of your paper, you're discussing your critical parts of your paper, but also that you are tying it back to your objective and also your abstract. The truth is that abstracts are always written. It should be written by the time your paper is completed. Often you will find sometimes we are pressured to finish our paper, to rather submit an abstract before your paper is finalized, so you end up writing an abstract and then fitting your paper into it. That's not the best way to do it, but it does happen. So what I was trying to say is, looking back into your discussion points and your conclusion, they all have to speak to every piece of your research paper, how you're writing, or if you're reading, they all have to work together. It's kind of like a little link that ties back together, and your abstract has to summarize your entire paper. So your abstract will say the beginning of your research, what is it, in a short way, and then also we'll have a bit of that conclusion, whether what did you find or didn't find. So all your paper has to line up with each other. Also, look at your the way you're writing your conclusion. You always want to go back to your numbers, to your percentages, and just kind of summarize it. And if you remember at the beginning, I said one of my professors, when she was teaching us how to kind of skim through our papers, she was saying, look at those conclusions and see the numbers. They always will have the entire methodology and the entire data analysis. It's just going to be summarized in less words there with the percentages and the final findings in there. So that's kind of a neat way to skim and skip through these papers to find the information that you are looking for. But when you are writing it, you have to make sure that there is no mistakes in there and that your numbers are matching in your data discussion and what you're drawing the conclusion out of it. So if it was 30% in your discussion, it should be the 30% in your conclusion. Okay, so how are we reading the research paper? So back to being again back into our literature and how it's how is that actually being done, and when you're having a paper in front of you. I always said don't discard your papers just because necessarily is not at the first not necessarily what you are looking for. Keep them around because you may actually need them for some similarities if they're not 100% what you're looking for. If there is a newer research, so if there is new studies and new methodologies, don't bother looking into something that is now outdated, because it's no point to you. You're not going to be reflecting to that unless you're doing some historical overview and you want to compare and contrast. But if you're looking into what's new and happening and what is actually current in your world, don't waste your time referring to old studies, or sometimes you will find some of these papers are pulled down or they're no longer active, so there's no point for you to use that. Do take time to read your papers. There is that part that I say skip and skim through your papers when you're gathering your materials, but once you have in your hands what you wanted, take your time to understand the material that you're reading. So I would say have that skip and skim through, save it, and then the important parts are when you get into the methodology and data analysis, look at the detail around it and how does that translate to what you're going to be either writing, or if you're just using this as something to get educated yourself on any of these papers. So take your time to actually think about the processes that they're describing, and also see if this is something that you can follow in your own setting. And then once you're done and you had an opportunity to read all your gathered information, I would say I like when I'm reading, whether it's a paper or if I'm reading in PDF, any of these documents, I like to highlight. And I kind of have always a piece of paper next to me. I'm writing down. Sometimes they don't make much sense, so they're just kind of my thoughts that so I read on page 3, a methodology, and it sparked my interest about something that I may want to investigate further. I write down this is what I just a couple notes next to that to go back. and also helps me if I want to, say, reference a certain part, I highlight that, or if I would want to investigate further what did they do, whether was that something that I want to prove and investigate further if there is any other articles that are corroborating that finding. So there is different ways. It has to be your work. It has to be something that you are comfortable doing, and those are your findings in the end, and you're going to be using it. So I feel like we all have a different way of, first of all, reading, doing the research, and gathering that information. Some of us like to print and keep the prints next to us while we are working through it. Some of us prefer electronic. It all depends on how you work. But it's important that you don't lose your research, whether it's on paper, whether it's electronic. Make sure it's always handy, and you can always go back as you're working through your own study. Yeah, so point here, we are discussion in our chat box. They're talking about the visuals in these papers. So it is not just a visual to be an eye candy, but it's also, I find some of these charts are easier to read for people who are really comfortable and know how to interpret these charts and know how to skim through the findings. It's easier for them to go through a higher volume of papers just looking through your graphs, because that just gives them a quicker view. They don't have to read the explanations and interpretation of your tables. You always, of course, want to put that in your paper, but for someone who is highly skilled in reading papers, they just love going through the tables. It's easy for them skimming and sifting through and actually either deciding they don't need this paper and discarding it, or using it for future. So again, we are looking into how to read your research paper. I think we just had that discussed. Always make sure you read your title and abstract, read your introduction, and then finish with your literature review. How does that fit in? Read your conclusion to find the results. And if you find that your paper is relevant, you can go always back to your article, or you can actually go back to their references and find what is that you found so appealing in that study. So things that we in IPAC do read quite a lot are the epidemiological studies, and there's just a little diagram for all of you who like your eye candy in the graphs and charts. So how are these studies actually divided or split? So you have your experimental studies and observational studies. And so the observational studies are always easier for us to be involved with rather than experimental studies, because in our field we deal with human lives, so it becomes quite a challenge getting into any experimental studies. So we often end up looking into retrospectively into outbreaks, and it's completely unethical to cause an outbreak, for example, to observe it, and no one in right mind would do that. But there is some of the experimental studies that are done that you are all familiar with are the drug studies, for example, medications, where they need to be completed to ensure that we have done all the due diligence and the studies are completed. So you will find that being done in usually larger centers. Sometimes they may involve their sister facilities that are not necessarily part of these large centers if they have the right population that this particular center doesn't have. And then when you're looking into your experimental studies, they're broken down into randomized or non-randomized studies. And then for your observational studies, you can't really do the randomized studies because that is something that you are not having any influence at, right? So you're looking into them as analytical or descriptive. And then those are, I would say, those are the most that you will be either reading about or completing are your cohorts and case control and cross-sectional studies. So that's pretty much with regards to the studies that we do in IPAC. So generally speaking, you'll end up with some of these experimental studies that you may do is your use of alcohol-based hand rub. You can also do any of the hand hygiene product. You can also use some of the stool management products like your Hygie or Zorby bags and things like that. And anytime you are intentionally involving a patient or you're intentionally involving a staff, you always have to go and get that study approved by your ethical board and get their agreement, because it becomes a huge liability for us if anything goes wrong, and they're quite prescriptive in a way how these experimental studies are done.
Can you go back to the slide before the graph?
Mm-hmm. Yep.
What were you saying about that, Cornelia?
So I was just saying it's all more or less all the same, and how to read your research paper is always start with your title, right? So this is the most important part, how you're going to identify whether it's your topic of interest or not. And then you're going down to abstract, because abstract is kind of like a summary of all of the important information that is in there, and you're going through your headings of the paper. So that's where you're going to see whether that methodology is actually something that is fitting to your research. And then look at their literature review. What did they use in their own research, and what did they use to support their findings, and whether that's fitting. So when you're looking into the papers that you want to use for any of your own work, that's what you need to identify the quality of this paper and relevancy of this paper, right? And then finally you read your conclusion to see, is this something that you were looking for your own findings to be similar or not. And I mentioned before this, just because something is not 100% replicating what you're looking for, it's not a cause to discard these papers. It's just you may find that there's parts or elements of the papers that are relevant to your own work.
Thank you.
No problem. Okay, so our epidemiological studies, that's what we had in relation to the previous graph. They are usually either exploratory or descriptive, and then you're looking into these, they used to almost like prove your theory. So you're looking into your null hypothesis and you're proving them. Usually you're looking into this description of events and situations that have occurred, and then you're looking as part of your study, you always want to have your data collected. So you want to have either, as I said, your focus groups or your interviews or observations. So if you remember when I said when you have this alcohol-based hand rub or say a skin lotion. So those are your focus groups. You can have a smaller group in a facility that is part of it. You can also do interviews with them, and they can actually give you a feedback in terms of how did they like it, did they like how it felt, did it leave any film on their skin, did they feel that it may be drying or tight. And then also there is that observation piece that is independent. So how are you gathering that information? So of course, as an independent observer, you can't say whether something is tight on someone's skin, but you can say whether they are gravitating towards product A or product B or product C. So if your product is blinded, which they should be, you are the only one who knows. So sometimes people prefer a scent of a certain product, or they prefer a foam over a gel. So those are things that they will be able to tell you, but they should not be able always to identify the product. So some people will say, oh, I like such and such product because it keeps my hands more wet and I'm feeling like I'm actually cleaning my hands, versus I don't like the foam because foam doesn't make me rub my hands for the longer time. Or they may say, I don't like the scent of it. So that's the information you're gathering from the interviews and your focus groups. So I mentioned earlier your null hypothesis. So usually when you start any of our epidemiological studies, you start with your null hypothesis. So that's a very statistical terminology that we use. And it's usually a statement that you want to, it's a statement that you want to achieve. So it's, how would I describe this to you? So you want to say you want a change in certain practice, and by introducing a certain measure, the outcome should be X. And now you're trying to prove that the actual measure that you implemented has resulted in X. So sometimes there is no effect, nothing changed, and that happens. And if rejected, then your alternative hypothesis is accepted. So then you change it to alternative hypothesis, and a statement of these of the null hypothesis. So you have to, usually you hope to go in one direction or the other, but sometimes it just doesn't happen. And I mentioned before, you want to be comfortable to recognize that it did not come, your outcome is not what you were hoping to achieve, because you might have spent money in purchasing certain cleaner or training staff in certain fashion. You were hoping that this would reduce the number of infections. It did not happen. So being able to speak to that when you are writing your papers. Oh, sorry. So like some of these tests, it can be, there is no relationship between smoking and lung cancer, which we know after so many studies that in fact is the case. So our patients on urinary catheters with your Foley's have higher UTI rates than patients without urinary catheters. So you want to be able to have your control group and your study part. And then also say, like, another example would be a length of stay in hospital associated with more risk of acquiring healthcare associated infections. We know that's the case. But so you would be comparing your groups of people who are staying over a certain period versus people who stay only, say, like 2 days versus people who stay 10 and more days and things like that. So so you can either accept or reject these null hypotheses, and you are, as an investigator, you are the one to reject these null hypotheses. Okay, so that's the end of that session. Did this make any sense to you guys? That do you feel like you are going to be more comfortable doing your research and be able to identify good resources and good quality, credible resources on on internet or just going through your books.
Well, I definitely do, Cornelia. The only question I actually had for you now regarding, the null hypothesis, I know there's like certain like values, like the P or something. Like, are we supposed to know all of that as well?
So for this particular purpose, no. When you write your papers, I would say statistics is not something that is usually a strong skill in a lot of people, and there is ways to calculate that. But if you're doing a research study that does speak to your rates, you definitely want that included. So if this is not something that is your strong suit, you can always reach out to epidemiologists. So usually IPAC teams in large facilities do have access. They employ epidemiologists on their teams. Other resources that you can tap into is your local public health units. They always have an epi specialist. To be quite honest, I mean, it's always sounds more complex than in reality is. There is formulas that you can use. You can find them on the internet. I can actually send you a couple of links after the class that I have been using because, as I said, math is not always our strong suit, and I'm not the person that is highly skilled in math, and I managed to get through that part of my own research in the past. But usually you're deciding on when you're looking into your p-values, whether you're looking at what is the confidence intervals that you're looking at. Do you want to be at 99% or 95% of confidence interval? Usually it's acceptable anything from 95, right? But depending on your studies and how is that being dictated, you may want to go to that higher interval confidence.
Yeah, I'm just asking because I probably did this like 7 years ago in human resource management. We did a whole thing on research. It's pretty simple. Like when you just know, like when P is this, then you know, like it's accepted or not accepted.
Exactly.
So that way, when it's just stated out for you, it's more simpler.
Exactly. So you can't reject your hypothesis without calculating your p-values, right? So you can't do it. It's just simply a part of the process. So the thing is, I find that a lot of people try to write their papers without actually stating that null hypothesis and kind of skirt around it. But a well-researched paper, and when you're dealing with human lives and findings in terms of infection rates, you want to give yourself that credibility. And it's realistically, as I said, it sometimes sounds so overwhelming and people are afraid of it. But as you said, it's not that difficult. Once you create your bell curve and you see where you're falling under that bell curve, you can tell immediately whether it's accepted or rejected. But that's the math part that you have to do.
Yeah, I do appreciate the research section of this program also, Cornelia. But in my line of work, most of the big companies, such as the big companies that owns retirement and long-term care, they also have doctors. You spoke about Dr. McGeer. She was on the infection control team of one of the companies that I work for. So she did a lot of the bell curve and a lot of the graphs and stuff like that. So the IPAC lead nurse didn't have to do that part, so she just talk about the variants and all the other stuff. So yeah, it's good to have some research and some background in that.
No, for sure. Absolutely. And I think I feel that in IPAC world, we are just opening the door in a wide sense to practitioners to participate. And anytime you have an opportunity to join any research or be a part of Paper Do It. It's so rewarding, and it's quite an experience to be a part of a larger team that you can participate in and see the nuts and bolts, what goes in the research, what actually goes in the work behind the scenes that you don't see necessarily when you're reading these papers. And then also, looking back and to see that you were a part of that is something that enriches you as a practitioner as well. But also, I think it's important for us to be able to speak about our everyday work and share that in a scientific world where we actually have a respected voice.
Yeah, definitely.
Oh, sorry. Cornelia, can I also ask you a question, just because I know you're limited on time? There's like 2 minutes left. For the Unit 2 researching the literature, like when I'm opening up, it doesn't look like a discussion. It looks like a chat. I just kind of wanted to know what that is. Like there's a whole bunch of like, please review, and then, we have a whole bunch of articles that we can read. Yeah. But there's no like actual open thing with a discussion. It's more of a chat.
Yeah, so to be honest with you, I didn't know which one will work when I was creating them. Last week was a forum that I created, and this week was a chat. So let's see how that works. If not, I will open up another forum, just create a forum platform for us to discuss for anything further. I just added some papers for you to read. And then if you feel that I can also add the links that you guys were looking for, the p-values, and then we can chat there about some of the other things that you would want me to touch base on.
Okay, sounds good. I just wanted to make sure. Just
no class tomorrow, okay?
I was just trying to make sure. I'm opening this and it's coming to a chat and nobody's in the chat, but okay, sure.
No, it's okay. So you try posting in there, because I'm not familiar. I'm new, as you guys know, I'm new to this platform myself. So I'm also playing around trying to figure out what works and what doesn't. So let me know if it doesn't work. We can always adjust. That's what flexibility is. We are there to support one another. But just wanted to remind you, no class tomorrow.
And just so I'm making sure, there's no actual question. It's more kind of like a reflection of what the articles that we're reading and what we kind of find interesting and that we want to talk about.
Yeah, I did not, as I said, I just added some of the links in there. I didn't set any topic for discussion. So I want to see whatever you feel that we need to address. I can add more information to it. I find whenever we talk about research, it's almost like a cloud somewhere up there. It's quite lofty until you start doing it and everything starts making sense.
Okay, sounds good. Thank you so much.
No problem. Everyone good here? Any other questions? Okay. So carry on through the next week. As I said before, please don't stress over these discussions that we have through the week. It's nothing to be a cause of your worries. We can always discuss there, and it's no pressure. I just want to an opportunity that if we were in a real classroom, you guys would actually have an opportunity to see each other and talk and exchange and even break into smaller groups, and feel free to exchange your experiences.
Cornelia, I also wanted to just mention, I did try to post in the chat for discussion 1. Like I've already posted and I replied to another post, but you had a question about the just-in-time teaching.
Mm-hmm.
Yeah, so I did write it up there, but it's not showing up. So anyway, I just wanted to clarify what I was saying with just-in-time teaching. It's just like when I give a lecture about like hand hygiene or donning or doffing, do return demonstration, it's a completely different story when they're actually in practice and they're doing it, and then I observe it. So I'll usually like kindly take them to a side and just have a conversation with them, like ask them how their day is going, kind of like make a remark because it makes them less hostile, less hostile. And then you can actually have a discussion and, you know, like be like, hey, like I noticed that you didn't do this. You know, like, is that just normal practice for you? Or, you know, like, I know you're busy, like, you know, something like that. But I'm finding that the just-in-time teaching works a lot better than just doing like my demonstration and their return demonstration, because they're just following what I'm doing. I'm giving a rationale behind it, but when they're actually doing it in practice, they'll be like, oh, wait, I totally forgot that. And then they realize that. So I did post that, but it's not posting. So I just wanted to put that out there.
No, it's absolutely, you're right. And it's interesting when we as observers are looking at the activities that are happening. I find with hand hygiene is very similar, because some of these things are becoming very, people are doing them day in and day out, and it's almost like that broken telephone game. What we think that we are teaching them, it's not always the case that they're actually adopting and accepting the information and then able to replicate that. So you're right. Whenever they're in crowds, it's no point of reprimanding anyone. But the good way to get around it is if you see that someone is actually performing right, and point them out. So if you see that you have someone who's always doing it right, tying their ties at the back and wearing their gloves over the cuffs, point that out and say, hey, you know what, has anyone seen Susan? Susan's doing so great. Look at those gloves over those cuffs, and make a big hoopla over that, because that's more of a positive reinforcement for Susan, but also other people will look and see what is correct. And you will find that sometimes they will tell you why they can't do it the right way, whether the elastic is loose or the gloves are loose, or there's always something that doesn't work. So you can always talk about that with them.
Perfect. Thank you.
No problem. Thank you. All right, so I see people are signing off, and I want to say thank you all for joining us today, and have a lovely weekend, and let's chat over the week, and then I'll see you next Friday again.
All right. Bye.
Bye.